Dr. Richard Krasuski from Duke University. Today we're going to talk about combination therapy approaches and whether they can be cost-effective. We know that these agents are effective in terms of improving patient quality of life and reducing morbid events. But morbid and mortality events, if we can reduce them, the question is, are we actually reducing the cost of these patients and their treatments? The treatments are no doubt expensive, and especially when you start adding up therapies, the cost tends to escalate. So what is the evidence? At this point, we're still in a very early stage of collecting this information, but this is data out of a large commercially insured Medicare Advantage registry here of over 4,000 patients with pulmonary hypertension. In this cohort, 57% of patients had pulmonary arterial hypertension-related hospitalizations over the follow-up period. And out of these, 52% had greater than one readmission in the follow-up period after discharge from their initial hospitalization. So the mean length of stay for these patients was pretty high. It was about 2 weeks here, you can see, in the patients who were from commercial insurance, and about 17 days in the patients that had Medicare. And the overall mean costs, including initial stay and hospitalization, were about $134,000, almost $135,000 for commercially insured and $53,000 for Medicare Advantage. And really, readmissions accounted for the vast majority of the hospitalization costs. So even though you're paying up front with medical therapy for the medications and it's an expense, the reduction in cost from reducing hospitalizations can be rather substantial. And this data suggests that rehospitalization is not a trivial thing in these patients. As a matter of fact, half of those patients get rehospitalized. So in summary, we're really only at the beginnings of looking at data for cost effectiveness for patients with pulmonary arterial hypertension and their therapy. What we know is that hospitalizations are common and they're very expensive, and that these medications clearly reduce hospitalizations and therefore should reduce that cost. It remains to be seen whether subsequent cost analyses will verify this as a cost-effective strategy for managing patients with pulmonary hypertension. And I thank you for your attention.